Hello, hi, welcome back to my YouTube channel. So today we'll be having an interesting topic, and this topic is for any man, woman, boy or girl who is intending to become sexually active or who is already sexually active. And today's topic is chlamydia, which is the leading sexually transmitted infection in the world. Now, chlamydia is a sexually transmitted infection that is caused by the bacteria Chlamydia trachomatis. And then one thing about this chlamydia is the fact that it's a silent infection, in the sense that majority of the people that have this STI doesn't even know that they are down with it, and that's why regular screening is actually advised. And it affects younger people and men who also have sex with men. And one thing about this chlamydia is the fact that it doesn't just affect one part of the body, it affects different parts of the body. Like, it can affect your eyes, it can affect the anus for those that have anal sex, and it can also affect the throat for those who have oral sex. And then what can you see that will be an indication for chlamydia? Firstly, if you're having bleeding in between periods. Now, you know that during your period this is your normal flow, but in between the periods it's just like you're having bleeding, then it's an indication for chlamydia. Secondly, painful intercourse is also an indication for chlamydia. Then white or yellowish discharges that may have a foul smell can also be an indication. Pause in your urine, painful urination, that's dysmenorrhea, painful periods, and itching, and just most of those signs of sexually transmitted infection. And that's why it's advised that you go for regular screening if you're sexually active, and if you know you are not committed to one partner, that's one sexual partner. So can chlamydia be prevented? Yes, it can. First of all is the fact that you have to get one sexual partner who is committed to you and you are committed to the person. It will help you lower your risk of not just chlamydia but other sexually transmitted infections. And then secondly, ensure you use condoms. If you know you can't find one partner, please don't risk your life. Just ensure you get condoms and make use of condoms. And then if you're having oral sex with persons whom you are not committed with or whom you don't know, please ensure you use dental dams. And then if you make use of sex toys, I will advise, please do not share. But if you insist on sharing, ensure that when they bring back the sex toys, you wash them properly and before using them again. And now, can this chlamydia be treated? Definitely it can. All you need to do is just to go and get yourself screened and be properly diagnosed, and then the treatment regimens will be given to you. But please, during the process or the period of those treatments, you are advised to abstain from sexual intercourse. And then, after treating this chlamydia, is reinfection possible? Yes, there is high risk of reinfection, and this can be as a result of the fact that you treated yourself and then you did not treat your partner, or after taking treatment you now had a new sexual partner who has this chlamydia and doesn't know, so you now get reinfected. So you need to ensure that you screen yourself regularly and you are committed to one person. And what are the complications of this chlamydia when ignored? It leads to infertility both in women and in men. So for the women, one thing it does is the fact that it causes scarring in your tubes, which makes it hard for the sperm to reach the egg. And even if fertilization occurs, even if the eggs get fertilized, it's going to bring an issue for the embryo to travel down to the uterus. And then for men, we have the epididymis, which is the organ that stores sperm. So it will actually cause inflammation of this epididymis, and also it can cause swelling and pain in the testicle, which is the organ that produces sperm. So you see, once the organs that produces sperm and the organ that stores sperm is actually affected, then there is nothing going to go and meet the egg for fertilization, thereby resulting in infertility. So please ensure that you go for regular screening if you are actually sexually active and you are not committing to one partner, but I would advise, if you don't want to commit to a partner, abstain till you get a faithful partner who will commit to you and you also commit to the person, to actually avoid or prevent all sexually transmitted infections and their stories. So I hope that this video has brought knowledge and enlightenment your way. You've learned facts about the chlamydia, how it's the leading infection, and how you can prevent and treat them, and how you can indicate that this thing or these signs I'm having are actually pointing towards chlamydia. Remember that prevention is always better than cure. And please do not forget to like and share our videos, subscribe to my YouTube channel, and do not forget to turn on the notification bell to get more educative videos like this. Thank you.